Hello, hello. Welcome to the TOOMER TALKS Show. I'm Dr. Catherine Toomer. I'm a family medicine and community health physician and founder of Total Weight Care Institute. And I'm here every Tuesday live at 6 p.m. I've been on some speaking engagements, so I've been away for a few weeks, but I'm back now. And I hope you're here to join me. So please, if you're here listening, put in a hashtag and where you're listening from and your name. And if you watch later, put in hashtag replay. Now, I am looking at my Wi-Fi. It's saying that it's a little unstable. So I'm hoping I can make it all the way through and that my everything works throughout. So today what I wanted to talk about is how to find a good doctor. So the question for you: how many times have you gone to a doctor and you get back in your car and you feel like you just want to cry? It's happened to me, and I am a doctor. How many times have you gone to visit a doctor and then you feel like you have a complete weight? That's happened to me. It's happened to all of us. And then how many of you ask around saying, who's a good doctor for whatever it is that you're looking for? I have, and many others have. Well, this is the thing. There are ways of finding good doctors, and usually by referral, asking people around who've used doctors and who they like, and that helps. That's how I find good doctors. But also knowing how to recognize one. And sometimes what we think are not good doctors are actually doing us a favor. And so I'm just going to talk a little bit about what it is that makes us, I'd like to think of myself as one, good doctors. So what a good doctor is someone who's willing to investigate what it is you come in for. Now, assuming that what you came in for needs to be investigated. One of the things that happened over the years is that we learn how to recognize what's serious and what isn't. And sometimes the internet makes people think what they have is a lot more serious than what it really is. And so coming in, expectations may be worked a little bit. And so it's always assumed that the doctor is being dismissive when in fact they could just be telling you the truth. So really understand where you got your information from that makes you think that what you're hearing isn't true. Was it from reputable studies, or was it from, your cousin, brother's friend who, had the same thing or something similar? Was it from an internet group? Was it from TikTok? So always think about where the information came from before assuming that what the physician is telling you isn't true. The other thing that makes a good doctor is one who takes all of you into consideration, not just what's wrong with you physically, but also he takes into consideration your psychosocial makeup. They want to make sure they pay attention to how you feel, not just what you're feeling, if it's pain or something else, but how you feel and what your life is and how you maneuver through that life. Because when it comes time to make a decision about what happens next, it's really important that those things are taken into consideration. The other is they use time very efficiently, and so can get to the bottom of why you're there rather quickly. And unfortunately, it may feel rushed sometimes, but partly because the way insurance reimbursement works, particularly with Medicaid and Medicare that just got slashed again, in order for doctors to keep their lights on, they have to see a certain number of patients a day. And sometimes it's just not physically possible to spend more than 15 to 20 minutes with a patient, unfortunately. And so often, really good doctors who just simply cannot do that will end up not taking insurance just so that they can spend longer with patients. But I can tell you one thing that doctors are not: good doctors are rarely on time. And the reason is that we take care of things as they come up. When you have a doctor, you want to make sure you have a doctor who addresses things that are serious at the moment that they're serious and won't dismiss them just because they're trying to stay on time. If there's an emergency, they'll address it. If there's something far more serious than what you think it might be, they'll stick around and take care of it. But what that does is often put them behind. And so when they end up seeing other patients, they're often behind. So often when your doctors are late, it's because they're actually good and they're listening to the patients they have before you, or they took care of an emergency before you. The other is good doctors aren't always readily available. Because of this time of electronics where we're able to kind of send messages whenever, send emails whenever doing, that the assumption is you're going to get a response right away. That's just not realistic, especially when you have a person who's spending all day with patients and they often don't get to messages till the end of the day. And that end of the day could be several hours later than what they anticipated, and they still have families, they still have a life, and they cannot get to those things. So it may be the next day. So good doctors often take sometimes 24 to 48 hours to respond to a message. So that's what good doctor is always readily available. Another thing that a good doctor isn't is we don't always have the best bedside manner. Now, everybody has good days, everybody has bad days, and sometimes those bad days can come through. So when they do, sometimes you just got to give them a little grace. Now, if you go to somebody and they're that way all the time, and every single time you go to see them, then that might be something either to discuss with them or to consider what is really going on. And before I continue, I just want to say hello because I am back after being gone for quite some time. So hello, Denise. I'm not sure who Ocean Plays is, but I like the name. And hello, Claudette. How are you? So again, if you're here, say hello, tell me where you're listening from. And if you're listening later, put in #replay. And before I continue, follow me on YouTube. Subscribe to my YouTube channel. I do respond to the comments that come in. If you have questions, I respond to them. So if you want to get in touch with me, that's a good way, or you can contact me through help@drtoomer.com. Hello, Denise. How are you? All right. So how to find a good doctor. Now, again, doctors are human. We are. And we have bad days. So give us grace, just as we do for you. Many good doctors are put in bad situations. And like I mentioned earlier, insurance companies sort of dictate how much time we can spend with the patient because if we want to keep our lights on. Sometimes if you have a patient who's going through a particularly hard time, you're not just going to rush through an appointment and then leave. I am a family medicine physician, and there have been many times when I've been with patients who've lost a family member that morning or the day before, and they didn't want to cancel their appointment because, as we know, especially with primary care doctors, it can be a long time before you can reschedule. So they'll keep their appointments. But when they walk in, it's very clear something's wrong, and I'm not just going to leave them in their time of grief. Yes, it may put me behind, but I think that for most people who are in that situation, they would hope that if they came in contact with someone who may be able to help in some way more than just saying, "Oh, I'm sorry," will not just walk away. So good doctors, like I said, are rarely on time because we do spend time with people who need us. The best doctors, however, listen, and they aren't dismissive. So I'm just out of curiosity for those who are listening and those who can type in the comments. What do you consider a good doctor? When you walk into a doctor's office and you leave feeling really good, what's the number one thing that makes you say that was a really good doctor? Is it kindness? Is it concern? Is it being on time? I'm just curious as to what you consider being a good doctor. And that also dictates how you find one. Because what's important to you is different for each person. Some people like efficiency. Some people don't care about bedside manner. They just want someone who's really knowledgeable. And so it really just depends. But I'm just curious as to what you consider a good doctor. And Donna said, one who listens. Absolutely. And that is, I feel, for me, that is the number one criteria that I look for also. But the second criteria is that they know what to do once they've listened, because it doesn't help to listen if they don't know what they're talking about afterwards. For me, I want to be listened and heard. I agree. So the best doctors do listen, and they aren't dismissive. But they also tell you the hard truths. Sometimes you don't want to hear what doctors have to say, but doctors who are really good aren't going to sugarcoat information if it's really, especially if it's something that will greatly affect your health. The other thing that doctors who are really good have are good systems. They're very systematic, and they don't like being deviated from that system because that's how things get missed. And so they really like to go systematically through all the things that make them sure that they've caught everything. The other that makes doctors good is they explain the process to you in a way that you can understand. They also allow you to ask questions when you don't understand. Now, there is a certain, within reason, asking questions about the moment is good, and asking questions about your process is good. Now, asking questions about a family member who's not in the room or wanting their opinion on something that does not pertain to you at that moment, no, those questions aren't. They really do take up time, and they take up time for you and the things that you want. And so then what happens if doctors start answering those questions? They don't have time to get to the things that are bothering you. The other is they don't make exceptions, or I should say we don't, because I'd like to include myself as being a good doctor. We don't make exceptions to our system. When we have a system that works, that allows us to see patients in the best way possible, in the time allotted, in being able to focus on what each person needs, there can't be exceptions that throw a wrench in that. And so sometimes when people request things or want things and they don't get it, they often get very upset with the physician. But what that does is it throws off what they can do for everybody else down the road. So sometimes throwing a rock in a river, it ripples. And so we know where those ripples can happen, and we just don't allow it. And it may be frustrating, and it may be inconveniencing sometimes. But as many of you know, and I've done this too, we do things at the last minute. We we realize something, we need something right away. And unfortunately, the way medicine works, the way physicians work, it's not immediate. And so sometimes people want their emergency or their urgency to be our emergency, and that just isn't how the system works. And so managing expectations is really important. So a lot of, and that was my next point, a lot of what makes a doctor good is actually you, the patient, or me, the patient. We as patients make doctors better based on what we do and what we don't do. Now, of course, there's their responsibility, and it's not all our responsibility, but there are ways of making sure that you've done everything to get the best out of that physician. And if you've done everything that you can to get the best out of that physician, then you should get the best. And so managing your expectations when walking in. Physicians are not miracle workers. They cannot make a pain go away that you've had for years with one prescription, within one appointment, without doing any investigation, no matter how much has been done before. When you see a new physician, they're going to start at the beginning, no matter what other doctors have done. They're going to reinterpret the information that they're given. They're not going to use that information, especially if it's older than a certain amount of time. So it's really important to understand when going to see a physician, especially a new one, that they're going to start over. So one of the things I always recommend is if you see a physician, keep seeing the same one so that they can go to the next step. Otherwise, you go to a new one and it's just going to start all over. We can't make time. So when insurance companies essentially dictate how much time we can spend with a patient, we can't make that time longer. And we can't increase how long it takes or decrease how long it takes for something to happen. So expecting a long-term symptom to be relieved immediately shouldn't be expected, and therefore managing expectations is very important. The other is making a list of your complaints by priority. Because time can be limited, there's only a few things that can be addressed within the amount of time that you have. Always bring up the most important first. Knowing your medical history is also very important. Now, a lot of times, and even as a primary care doctor, I'll have a new patient and I'll have gotten 200-300 pages worth of information on that patient before I see them. There's no way possible that I can get through all of it. And so having a summary of your medical history, a list of your medications, a list of your diagnoses, a list of the surgeries you've had, a list of all the doctors that you see. Those things are all the list of times you've been hospitalized. And if you've been to an emergency room like soon before seeing a doctor, make sure they know that so that they can address those things. Because obviously, if something was serious enough to send you to the emergency room, that's something a doctor should know as soon as they see you. And it shouldn't be something that's brought up at the end of the appointment, like as a by the way. Having those things written down, you can or even what I often have done, especially if something's kind of convoluted and it's a story, I'll write it out because it's a lot faster for my doctors to read what it is that's going on than for me to tell them. And it's a lot clearer when you're not in the moment and you're writing that information down. It is absolutely appreciated. And any doctor who doesn't appreciate you doing that, you need to find a new doctor, because most doctors would appreciate having that kind of information put together in that kind of a way so that they can make a decision rather quickly based on the information, because that's essentially what we do. We make decisions based on the information we're given. So the better the information, the better the decision. Also, know your symptoms well, meaning that if you have a symptom and there's an acronym, well, I don't know if you call it an acronym, but it's PPQRST. No, and I have a video in my YouTube library about this in more detail. But essentially what PPQRST does is it helps you become very succinct in describing your symptoms. Precipitous. What makes the symptom happen? Is there anything that happens right before? Is it a pain that happens after you walk? Is it a headache that happens after you sleep? Whatever it is, it's really important that you know if there's something that brings it on. The other P is what makes it go away. Is there anything that helps? Does it go away with Tylenol? Does it go away with good sleep? Does it go away when drinking water? Does it go away when talking to a friend? Because sometimes there are things that are symptomatic that are helpful when calm. And that's very telling. So knowing what brings it on, what makes it go away is extremely important. The quality of what happens. So is it something that really disrupts your life? Does it stop you from going to school, from going to work? Does it stop you from interacting with family members? Does it stop you from eating? Does it stop you from sleeping? Knowing actually that's S because that's severe. But anyway, we'll get back to that. But knowing the quality of what it is. So is it really sharp? Is it a dull pain? Is it something that's just kind of mild, and just kind of comes on every once in a while, but it's more of an achy or more of a nuisance than something that's really disruptive. Knowing those things are important. Knowing, again, how severe something is, whether it is disrupts your activities of daily living, does it disrupt any part of your regular routine in life, the thing, or does it disrupt something that you enjoy that you can't do anymore? That information is very important. Knowing if it's the worst it's ever been, if knowing the timing, if you, well, I missed the R. Well, let me see, PPQR. Oh, I forgot the R. So R stands for radiating. Does it move? So, for example, do you get a stomach pain that you feel also in your back? Do you get chest tightness that also makes you short of breath? Do you feel things that go up your neck and down your arm? Does it start in one part of your body and move to another? Knowing that is extremely important. And so PPQ, quality, R, radiation, is severity. And then T, timing. When does it come and go? Knowing when something comes and goes throughout the day is very important, because it's very helpful. Does it happen when you're tired? Does it happen when you first wake up? Does it happen after you've eaten? Does it happen when you have eaten or haven't eaten? You know, all those things are really important. So go to my video on my YouTube channel, look for the PPQRST, where I go into a lot of detail on this, because having that information when you go to your doctor's office is extremely helpful. And it will help us get to the bottom of what it is that's going on. And then be brief and succinct. I know we like stories, and I know we like to talk, and I'm one of those people. And my doctors always have to cut me off because I'll just start going. But it's really important that you stick to the pertinent information. You know, knowing the colors at a wedding are nice, but it's the chest pain you had when dancing that's kind of more important than, you know, whether you like the bride or the groom. So, or you know, who they were and what you think of them. So that, just be aware that there's very important information and there's peripheral information. So if you stick to the pertinent information, it makes things so much easier. And the other is being consistent when seeing your physician, because so if you skip appointments or make appointments too far away from one another when your physician asks to see you more frequently, it does slow things down. It also lends itself to compliance. When you're given medication to take it. And if you're not going to take it, then discuss that and say why you're not going to take it, because that's important information to know. And if you don't trust the person that you're seeing for whatever reason, then find somebody else, because a good doctor can only be good as long as you trust them. And trust that they've probably forgotten more than your internet friends have ever known. And I don't feel I'm being arrogant in that regard. I know what I learned in medical school. I know how much training I've had in residency. And I will never admit, not even admit, because it's never going to be true, that someone who's never had any medical training is going to know more about medicine than I do. Now, they may have had an experience that makes them very knowledgeable about their experience, but that doesn't mean they know more about the overall disease. And so that's why it's so important to understand that experience is helpful. Lived experience is very helpful in telling people what they may or may not expect. But it is not advice, it is not expertise, and it is not education. And so therefore, your expectations based on one person, two people telling you the same thing doesn't necessarily mean that it's true. And so one of the most important things when finding a good doctor is don't believe everything you think. And I am definitely someone who believes in that, even for myself. So I guess the overall message is Doctors can be found. Good doctors are out there and they can be found, but they can also be made by how you interact with them. And one of the ways of making a doctor become a good doctor is by having your information in a way that they can use it to help you best. And so that's not to say there aren't some duds out there, because we all know that there are, but that, the profession is the same as anywhere. It's just that we come in contact with doctors more than probably anybody else because we have to. So of course, good or bad, we see them. But just know that all isn't lost. There's some good ones out there, and they can be found. And often, like I said, ask people, ask around. People will tell you. Now, the other thing, though, to be very clear about is that sometimes when you see a doctor and we're already scared before we walk in, we transfer that fear onto them. That's one thing that happens. The other is we also have our own prejudices and biases. So depending on who we're seeing, that might get transferred to them. The other that happens is that if we put a lot of importance into someone stopping and listening to us, that is fine. And that's good. But understand what that means. Does it mean they're having eye contact with you? Does it mean that they're writing so that as you're talking to them, they're making sure that they get their note written so that they never forget what it is you told them? And understanding that information is how we function. So how we gather information is the most important part of that interaction. And so making sure that the information you give is good information. The other I forgot to mention is allowing doctors to pivot. Good doctors may pivot, but we hear something else that we know is way more serious, and we'll focus on that. And so sometimes it is frustrating. You walk away saying, but I came in for this thing, and all they wanted to talk about was that thing, because that thing can kill you. This thing can't. We always go for the thing that is the most serious. But it's our responsibility as physicians to explain why we've pivoted. And so you can always ask, why are you focusing on that and not focusing on this? And sometimes doctors may tiptoe around it because they don't want to scare you, but ask. Are you not telling me because you're trying not to scare me? You can ask those questions. We're human. We're not, above anybody else. So before I continue, I do want to say hi to Donna. Thank you for coming, Denise, Lynn, and Marsha. Thank you. Yes, I am back. Donna said, thank you for my gems of wisdom. I appreciate it. I'll be sending people to your talks. Thank you, Donna. So if you have any questions, you can put them in the chat right now. If you think of any questions later, you can write to me at help@drtoomer.com, or you can put your questions below the videos. I will answer them. For anyone who's written to me, they know that I do respond, and I respond to questions. So if you have any questions, you can put it in now. This is something that's halfway short and sweet. I got it in 30 minutes. I try to keep it a little short so that you can have time to listen and digest it and get your questions in. So if we don't have any questions, I did miss you guys. I'm so glad I'm back. And I will see you again next Tuesday at 6 p.m. Eastern for the Dr. TOOMER Talks Show. And if between now and then, if you have questions that you come up with, either you can save them for next Tuesday, or you can write to me, email me, or ask me after the video. Good night.